Just how safe is your hospital? Well, this morning we have some answers. For the first time, Consumer Reports magazine has investigated hospital safety, and the results, they will certainly surprise you.
Dr. John Santa, director of the Consumer Reports Health Ratings Center, joins us this morning with the findings. Dr. Santa, good morning. Thanks for being with us.
Thanks for asking.
This is kind of distressing, frankly. This is your first survey on this. What were the criteria you looked at?
We looked at 6 things: infections, communications about safety issues, the degree to which you come right back in the hospital after you've been discharged, situations in which too many imaging tests that expose you to radiation are being done, common complications in unsafe hospitals, and then death rates for several conditions.
And which hospital scored the lowest?
Well, the lowest hospital in the country was Sacred Heart Hospital in Chicago.
Really? And why was that?
Well, across the board in those 6 areas, they did not do well. They got many of our lowest or close to lowest scores. So they weren't preventing infections. These complications were happening, people getting bed sores, falling. They had problems with doing 2 CT scans when 1 would suffice. There were a lot of things they could do better. But let me say, the best hospitals didn't do as well as I think they could, and they know that. The best hospitals know we got to do better. The problem is not by any means are all hospitals acknowledging that and making this a high priority. You
said something in the break here that just startled me, which was that a doctor, I believe, said that hospitals are the 3rd leading cause of death in this country. Is that?
That's right. For this story, Peter Pronovost, really one of the country's most prominent experts in terms of hospital safety, said that he believes if we kept the best track of this, that deaths from safety and error issues in hospitals would be the 3rd most common cause of death in the country.
That's really troubling. There are on your list, however, some hospitals that are doing the best work, and they are.
That's right. The Billings Clinic Hospital in Billings, Montana is at the top, and we talked to them. They acknowledge this is hard work, but they're getting it done. They need to do better. They need to keep making improvements, but they're getting it done, and so are many others.
I'm curious to know, because we looked at some of these teaching hospitals in your survey. They didn't do as well as you might think, and these were some surprising names because you usually associate them with some of the best quality health care.
Some big names we're talking about, yeah.
That's right. I think a challenge is these are hospitals that have a lot of priorities. We have a lot of expectations from them. They do teaching, they take care of tough patients. Our concern is, even for them, safety needs to be the top or near the top priority. Who else will figure this out when it comes to the really complicated stuff? And we're concerned that those really best hospitals, or the ones we expect to be best, aren't doing as well as we would all think.
Dr. John Santa, thank you.